Welcome back. You're watching the Power Breakfast Show, and this morning we want to have this conversation, a postpartum on the illicit brew situation we had in the country last week, where 6 people died because of withdrawal symptoms. And this morning we just want to understand what exactly needs to happen should we find ourselves in that scenario where you know someone who is abusing a substance, and how you can help them really. And to help us have this conversation, I have Ms. Gladys Chania, the director, Right at Home Alcohol and Drug Abuse Center. She's not new here. Good morning. And Dr. Catherine Mutisia, a clinical psychiatrist and also a senior superintendent at the Mathare Mental Hospital. Thank you very much for coming. And remember, any questions you have, 22422 is the SMS line, or you can get us on Twitter at Citizen TV Kenya. The hashtag is Power Breakfast. We'd love to hear from you, so get in touch. Thank you, ladies, for joining us this morning. I think the first question is, did we handle this scenario properly? This scenario being the illicit brew menace scenario. Did we go about it the right way? And I'll start with you, Dr. Catherine.
I think it's good that the policymakers are realizing that alcoholism is actually a serious problem, yes, which needs attention, and that's a good thing. It's good that we saw this is becoming a problem, and it's good we started from somewhere, but we need now to make sure that all aspects of alcoholism are taken care of. In terms of those who get into withdrawal, we treat the withdrawal symptoms, and eventually we see how to prevent relapse, because after we treat the withdrawal, and by withdrawal I mean for somebody who has been taking alcohol almost daily and then they stop suddenly, the problems they get as a result of lacking alcohol in their brain. Yes. Okay.
Ms. Chania, what's your take on that?
I think what she has said is very right. We needed this act that happened to try to cut down the source of the illicit brew. But after that now, this is now when you have got a great task. Because this great task don't just need anybody to do it. We need the professionals, we need the technical people on board. We don't need just now anyone to come in.
So this is now when the work starts.
This is now when the work starts. This is now when you see the professionalism of this country.
Yes. Let's get into that, and then maybe we can start with understanding the signs and symptoms of withdrawal. Dr. Catherine, what are some of the signs and symptoms?
Okay, for somebody who has been taking alcohol almost daily for a long time, if they suddenly stop taking the alcohol, and this could even happen, like for example, if somebody is admitted in hospital and they didn't tell anyone that they've been addicted to alcohol, or it could happen like what happened the other day when there was a crackdown and they were not able to access the alcohol they usually take. So within 6 hours, for somebody who is addicted, they would start getting what we call withdrawal symptoms. They might start shaking, what we call tremors. Some might even have fits, like a conversion, or what people might think it's epilepsy. Some might become anxious, and in severe cases, some will start seeing things other people can't see, what we call hallucinations. And in severe cases, one can even go into coma. Yes.
Ms. Chania, you run a center, rehabilitation center,
yes,
and you see this,
yes, I do.
Quite often.
Quite often.
What then do you do next?
Actually, when a rehab center has got treatment, actually like mine is treatment and rehabilitation, we have the line 1 that we do, and it's affordable or accessible in most of our hospitals, and that is why you see or hear people saying that in the hospitals we are able to do the treatment of alcohol withdrawal syndromes. But the only thing that can happen now there in the hospitals, it is the treatment, but not per se the severe cases like the ones that the doctor is talking about on the rehabilitation for the addicts. Okay. When someone has dependence. Okay. So when these cases come, as you are able to do the line 1, if they haven't been sent or referred from the hospital. The line 1 involves very accessible medications. I'm a clinical psychologist, so I can do that. And we do offer diazepams and Valiums, but that, which is actually Valium in the other language. But at the hospital, when this line 1 has been done, then they come to us when now they are coming for the rehabilitation. Yes.
So when by the time they're coming to you, they have already had some form of treatment?
The ones who have gone to seek that from the hospitals.
What if
but if they come direct to us, we do offer it, because we also give
what is the process? What exactly happens? So I've come, I've not gone to hospital, and I've been brought there. What exactly happens?
I am a psychologist. I'm not
You're not her.
I'm not her. Yeah. And so I'm not a mental expert like her.
Yes.
Me, I do the psychology part of it.
Yes.
And so what we do when they come direct, we have locum, or we hire
Dr. Catherine.
Dr. Catherine,
yes,
to come and do the physical examination on that person. Because some of them will come even when they are having some other medical problems. These people have been on alcohol for long or drugs for long. Others have even damaged their livers. They need to be done physical examination for us to know that they are okay for this kind of medication.
To come in.
And so now they'll be prescribed the medication by the doctor, Mutisia, and then they are left in the rehab for us to do the rest of the detoxification and the counseling on dependence.
Yes.
Yeah.
Okay, Dr. Catherine, you're a clinical psychiatrist. You have seen quite a number of these issues pop up in your office. What's usually the biggest challenge?
Okay, the biggest challenge is for people to actually understand that withdrawal can be that severe. And in fact, like when we were waiting to come in, somebody called me and explained how their brother is having conversions, fits, and has been having a blood pressure, and they're wondering, he's in hospital, they're wondering what is the problem. And I just found out that has he been drinking heavily, and the issue is actually he has been drinking daily. So most people don't actually realize that drinking alcohol almost every day to the point of getting addicted can actually cause these severe problems. And so when somebody starts having those complications, just because for some reason they were not able to access the alcohol, it takes a while before people realize. So it would be very good for people to realize that when somebody has been taking alcohol daily and suddenly stop, they could actually get sick. So that if you observe such symptoms, that could be in your background. And in fact, even in hospitals, general hospitals, you can have people who have had accidents. They never said they have been drinking alcohol daily, and when they're in the hospital, because they cannot access the alcohol, you see them start fitting, you see them start hallucinating, you see them start having sweating, their blood pressure is going high, and you're wondering what is the problem. So it would be very good even for the general doctors and for everybody, even nurses, to realize that this can occur, and it should be at the back of their mind when they're dealing with such episodes of conversion in a person who is not known to converse previously. Okay,
let's come back now to the home setting, and then look at what exactly happened last week in different parts of the country. These dens were shut down, and people didn't have access to alcohol. So what happened was they started having withdrawal symptoms. Now we have already discussed the signs and the symptoms of withdrawal. What should be my first step? Should I come across someone who is going through these signs and symptoms before taking them to hospital?
Okay, in my opinion, I would say the danger of someone withdrawing without help, it would actually be better to give that person some alcohol before you can take them to the hospital. Because if they stop without any replacement, then it can be dangerous to their life. So if in the worst case, if the hospital is far or you cannot access treatment and this person is fitting, the best you can do is start them on, give them some alcohol and transport them to the nearest doctor or the nearest health provider where they can actually get the right withdrawal treatment. Yes.
Also, you advise that give me a glass something. Ms. Chane is laughing. Give me a glass of, let's say a beer, and then in the process take me to hospital.
Yeah, it would be safer to do that than to just let the person withdraw if the hospital is far. But of course, if the hospital is near, then the best would be to take them to hospital.
All right.
Yes.
Let's talk about mental health now in light of this. Mental capacity tends to be the strongest in our body, because we can tell our minds what needs to be done, what cannot be done. But why is it so difficult then for an alcoholic to change their mind frame?
I think this is very clear, like in our society. We are who we are because of the environment and how we have also grown and what is around us. Most of the people abusing whatever they abuse, there are other underlying factors or the other agents that make them to do this. And so that is why it is very difficult for them to change or even to realize a problem is coming in, because he or she has other pushes that are pushing him towards that. And I always ask a question, why me and not you? Or why you and not me? It's because what is my agents are not what is your agents. Like now when we were just entering, someone was telling us, you go and talk about alcohol and treatment and rehabilitation, but remember there is unemployment in this country, there is poverty in this country, we have social gaps in this country. All these can tend to bring forth the abuse of whatever someone abuses.
Yes.
I even get out of the way of illicit brew and even alcoholism and say, even when you talk about gayism and lesbianism, let us try also to see the factors which are down there, the underlying issues. Because we have them coming in as drug addicts or alcohol addicts, but when you go further in their lives, because we do, because I want to know as a psychologist, why are you doing this? When I go further, I come and find a multiple of problems within one person. You cannot even believe it.
What about you, Dr. Mutisia? What's your take, on the mental capacity? It's said, like I said, the mind is the strongest part of our body, but then you find that it becomes very hard for an alcoholic to stop. Why is this a case?
Okay, like she said, we usually are interested to know whether there are any stressful issues someone has not dealt with, whether this person has enough social skills to be able to deal with any stresses in their lives. And also we evaluate, is there a crisis which could have precipitated the initial self-medication with alcohol, for example. For example, maybe somebody has had marital problems or some financial issues. So we usually look at that. And then as we treat the person, we also look at their social aspect. We also look at their family, because it will be a good source of support.
Yes.
So it is multifactorial. We look at all those things.
Okay. And we've brought in the issue of family. How then, what would you tell a family that is going through this? They have someone, because it's also very tiring on family members. It can also be a bit depressing seeing one of family members going down the road of alcoholism or drug abuse, whatever it is. What would you tell them? How would you want them to handle the situation, especially mentally now?
Sorry.
I'm saying I'm the alcoholic. Miss Chania is my mother. What would you tell her? Because it can be very depressing and frustrating for her. But you see, she also needs to support me. So I think it's also a very delicate balancing act when it comes to that. What would you advise her? There are those who say, my child is an alcoholic, I never want to see my child again. My child abuses drugs, I never... And then there are those who also cover it up and say she doesn't drink that much. Okay. She doesn't abuse drugs.
I think in this, and I know Dr. Mutisia will concur with this. Mostly, by the time a case is coming up or getting to her or to me or to the medic when it comes to mental illness, mostly the biggest percentage, it's not individuals who take the initiative.
Yes,
it is the family members.
Yes.
And when it comes now to counseling or to psychosocial support, you also do the family therapies, the setup part of it.
Also, there's a family therapy as well.
Family therapies as well.
Okay. So
and also, when it comes to the family, there's something we call codependence, where you might have actually some family members enabling this person and making them actually be able to carry on with the addiction.
And enabling is not necessarily buying me a drink.
No.
I think we also need to explain what enabling is. It comes in what form?
Enabling could even be like, this person is drunk and you call on their behalf, you say they are sick, when actually the problem is they are drunk. Or even sorting out their financial issues all the time when they have spent all their money in alcoholism. So we also, the first thing we do with the family is to educate them about the addiction, so that they actually get to understand this is a disease and how it can be dealt with. And we also teach them about how not to be an enabler, so that they avoid perpetuating the issue. Of course, people who are supported by their family do better than the ones who are actually abandoned. And in fact, now we are questioning, should what we used to say, hard love, be what we should be practicing? We encourage people now to be more supportive, but not to be enablers, so that this person dependent on alcohol can actually be able to stabilize.
Yes. Dr. Chania, sorry.
Actually that is very true what she's saying. Now in the family therapy part of setup, that is whereby you also push the family on the wall to understand that, as I said earlier, there must be a gap for someone to be doing what he is doing. And it could be the gap has come from the family setup. The family institution, and we have to agree, like in this country, in our society, has completely failed. What she's saying about tough love, that one is actually the way to go. When you start pampering someone who is already losing the way, you don't help. Today I'm calling it social tolerance. Social tolerance is making us lose it. And I said, like last time I said that you go and find a drunken person on the road and it's like, wachana huyo ni mlevi. And then you go your way. What we are tolerating in this country is what is making us reach the situation that we are in. You see your child is losing it, the school calls you for that, and you support and vindicate the school. Yeah? Someone don't go for work, you call on her or his behalf. He's not feeling well. You see? The school suspends a student, but the head teacher or the principal writes an explanation letter for that person. That person gets out of school at Form 2 without that he cannot go anywhere else in his life. Where does he go to? He has been enabled now to look for another source. So you think society also needs to play a role in ensuring that... It is actually wholesome, all of us. Everyone with his or her duties.
Let me ask you, how do you deal with this person who has come in, has come to rehab, is trying to get back in line, but then come back to society, and then there are those they'll always be branded an alcoholic, So what exactly what would you tell them? Because, and I'm coming from this place, there's a lady last week who stood up and said she used to sell illicit brews at the function for women entrepreneurs here in Nairobi that was held by the president. And she said she used to sell illicit brews, but she stopped. Now what has happened is, and she used to partake as well, what has happened is people don't trust her anymore. So she can't do business. So there's also the social aspect. How do you get them back integrated into society without having this patient go through depression?
Actually, the best way would be to deal with as much as we are addressing the physical, as much as we are addressing the mental, the social, where we now reconcile you with your family, we should also look at occupation. What are your skills? What are you likely to do when you go back? And educate the society. That is now the gap which we need to fill in. That the society needs to understand this is a disease and that we need to support these people. And even after leaving rehabilitation, for those who go to residential rehabilitation, that's not the end of the treatment. They need follow-up. They need to attend meetings. They need to have sponsors. They need to be followed up because they could actually relapse. Actually, it's very easy to stop, but staying sober is actually the problem. So that's why we actually have to do more and let the society get to know how they can support these people. Yes.
Ms. Chania, your thoughts?
What she has said is very true, and she used the word enabling there before. The family comes in again, the society comes in again. But remember, in this country, we don't have strong social networks. And that is why, again, I'm repeating the same thing, that is why we are where we are. Because we don't have strong social networks. When this person leaves the rehab, where does he or she go back to? To the same society where there are no network, where there are no social services. Yeah? Like right now, as we are discussing this, we are saying that it is a very needy thing to be done. But if you look at the structure alone, we don't have it. Sincerely, Dr.
So
we don't have it.
We need to build some form of structure, and this is social structure, you're saying.
Yes.
But who is to build it? Is it me and my family, you and your family, or us as a community, or Kirigo as an individual, as Dr. Mutisia?
It cannot be done by one person. And that is why the structure needs to be linked without the gaps, such that the society and everyone on board knows we have poured the illicit brew. Let me use that word because I'm feeling difficult to use it because I know it is just not illicit brew that is having the problem. We have poured the illicit brew. After pouring the illicit brew, we have the withdrawal symptoms. We have taken to the hospital for treatment. This dependence cannot be done in the hospitals because we don't have fully functional rehabilitation services. So from there, Dr. Mutisia, sorry, sends this person to the rehab. Then from the rehab, what next? There comes again work, occupation, the social network aspect part of it. And that is now where we lose it.
Okay, so it needs to be linked.
It is it's a very expensive process that that normally is not easy to afford individually, but the country or the state should have a system. The NACADA thing should have a system if it's there. And if it has lost it, let us know what is the replacement as by yesterday, not today. Because this is life-threatening.
Yes.
Let's agree that.
Sorry, there's something you want to say.
Yeah, about social support is very important. And if we could actually borrow like what we are doing at Badari Hospital for treatment of heroin addiction with methadone, the structure which has been set, it's actually that we have social workers who actually interact with these people at their home area and at the places they use the drugs, and establish connections with their family, bring them to the hospital, and after that they keep following them up. That should be the ideal structure for all drugs. So I would wish that the challenge would be the social workers working with the government a few. We need to have more so that we can have elaborate all structured treatment for addictions. Yes.
Partnership.
We've talked about rehabilitation centers, but we also need to be very honest with ourselves that it's a very expensive program.
It is.
Very, very expensive program. To be in a facility for 90 days in this country is very expensive. What are my other options? Do I have other options?
I don't think there are other options, but my government, it's mine because it's mine, it's yours, it's our government, should be able to come out with a way. And this is partnership. We have to agree we don't have rehabilitations in this country. Because when we talk about Madhale, that is one. The rest are private. How many ordinary Kenyans can afford? The average is 140,000 per the 3-month program. How many ordinary Kenyans can afford this? Yeah. There are some of rehabs, like for example, that has been created out of passion to help the community. Yeah, they are there, and count mine as one. Whereby the government can partner. Partnering means they can bring those people there because they are in space. The government has foods or have the resources. NYS is having the foods all over. It can still happen to these withdrawals, let me call them that way. Yeah, they partner with some rehabs. As the government, we have the food, we have this little budget for low-income people who come to offer some services, or for the aides who will take care of these people, even if it is the outpatient part of the detoxification, whereby they can do like halfway homes. The victims come in the morning, they do some sports, they do some games, they do some recreation, they kept busy. By 2 o'clock, they are discharged. They have taken their breakfast. They have taken their food, because nutrition is part of detoxification.
Yes.
Eating is part of it.
Yes.
So by 2 o'clock, they leave for homes. This person will continue changing. Unlike when they go, they are given some medication to detoxify. They go out after 10 minutes, 20 minutes, and they go back to intoxicate themselves again when they already have medication in them.
So for you, the most important thing is partnerships between the government
That's the only we
and
can do it.
the private
that is only we can
rehabilitation centers.
Because we have the private ones.
Yes.
Why talk about government build rehabs, government build rehabs?
Well, someone here says,
one day.
Kimutai Kiptalambo from Kitale says, each country should have at least one rehabilitation center to take care of our alcoholics.
If I may add on that, depending on the severity also of the alcohol use disorder, the mild ones, and where there is no medical complication, and by medical complication I'm talking of liver disease or heart disease as a complication of alcohol, the mild ones can actually be treated as outpatient, depending also on the motivation of the client and also on the social support. So somebody who has no social support or have medical complications, you cannot treat them as outpatients. But there are some few who with mild symptoms and who are motivated, you can treat as outpatient. And I agree with you, rehabs are very expensive. Even the government one at Madari Hospital, it's still very expensive because the patient still has to pay some money. And again, even that one, you find that you have to wait for 2 months for you to get space.
Yes.
So I agree with that particular person who is saying it would be good to have a rehab at every county.
Yes.
Because we can't have one facility taking everybody.
Yes.
So it would be good that, and it's also good for the government to partner with the private sector so that we have both. If the private is taking care of some clients, the government is also taking care of the clients. So I would encourage that partnership, but I would also encourage the counties, each county, because alcoholism or drug use disorders are everywhere. Every county should have a rehab.
Should have a rehab center.
Yes.
We're coming to the end, but I want us to talk about the issue of relapse. You know, some people end up going back to abusing these substances. How do you deal with it?
I think relapse in substance abuse can go up to 80%. So
of all the people who come into the
centers. It can go to 80%. And I want people to get this one seriously. Social network.
You're seeing the social network.
Because it is so serious such that even if I give you the 90 days rehab program, then you get back to the same friends, the same environment, to the same idol you are, sincerely. It will be.
Dr. Mutise, what's your take? Because I think differently. You know, you could take me elsewhere, but then if my mental state is not at 100%, or should I find something that triggers me, like lack of a job or, you know, lack of integration in society, then chances
the goodwill.
You
see, recovery comes also from your own goodwill.
True.
And you have willed to change.
True.
That is actually why you spent the 90 days. Because if you don't have the will, you wouldn't have spent the 90 days. You know, they are not just 90 days. It is 90 days of a lot of push. It's not easy to be in a rehab.
Yes.
Actually, the real essence of a rehab, I always tell people, a rehab is an opposite of a prison. Yeah? Or alternative when it comes to criminals. Because you also have some who are there because of so many reasons. It's an alternative to a prison, you see? And so it is not easy for someone to have a way of being in the rehab for 90 days if it's not really on good day.
Okay.
But whereafter?
Whereafter. Dr. Mutise, as we're coming to the end, I'd like to hear what you have to say on relapse. You know, how do you deal with a patient who relapses?
Okay, we always say, even if somebody has relapsed, because when you're talking of severe alcoholism, we are noting that it has a lot of physical impact. It's affecting your liver. It's affecting all your organs in the body. It's still safer to take this person to a place where they cannot access alcohol, even if it means redoing another rehab. Because that time you're giving your liver a break from alcoholism, rather than to just watch this person continue destroying their body, their liver, and all those organs. So
you're saying if I relapse, you quickly take me to rehab?
Not necessarily, because this person has gone through the steps.
Yes.
You actually assess them, see whether you can treat them as outpatient. But I've also seen people who relapse, and it requires another detoxification, and even after the detoxification might need another rehab. But not everybody who relapses will need rehabilitation. So that's why there is a place for what we call the AA meetings, where people meet like 3 times a week or once a week, depending on if you're working. You can go for a meeting on a Saturday, have a sponsor, the aftercare. And we know some places even have the halfway homes, where people, instead of going straight back home, they go to halfway houses. So it is very important that if you have been diagnosed to have alcohol dependency or substance use disorder, after rehabilitation, that there is that aftercare.
Yes.
You can't just say, now I'm well, because alcoholism is a chronic disease. Chances of relapse, we will teach you about relapse prevention. We'll take care of your social issue, the way we can be able to do, because some things need broader involvement, but chances of relapsing are there. So for those who have been treated and probably they have relapsed, they should not give up. You need to go back for the treatment again. It could be outpatient or it could be residential.
All right, ladies, thank you so much for coming this morning. Interesting conversation there. I learned something new, and I do hope our viewers as well have learned something new. You're watching the Power Breakfast Show. Don't go too far.